To focus on, during recent times, the number of heart attacks in the country has increased significantly. Sudden cardiac arrest in young adults is truly a concern. Medical experts believe that rising mental stress is contributing to heart related issues. In today's fast paced life, the joy and peace of mind are becoming rare luxuries. Even the opportunity to sit and chat leisurely seems to be disappearing. Sudden cardiac death is the swift and unexpected ending of all heart activity. Breathing and blood flow stop right away. Within seconds, the person is not conscious and dies. Sudden cardiac death is different from sudden cardiac arrest. Sudden cardiac arrest is the sudden loss of heart activity due to an irregular heart rhythm. Survival is possible with fast, proper medical care. Sudden cardiac death is seemingly healthy. People under 35 age is rare. It is most common in males than in females. Heart conditions that are not diagnosed, such as a genetic heart disease, can cause sudden death in teenagers and young adults. A heart condition that is not identified may cause a young person to suddenly die during physical activity such as competitive sports. But sudden cardiac death can occur even without any activity. Most sudden cardiac deaths are in older adults, particularly those with heart diseases. Estimates vary, but some reports suggest that about 1 to 2 young athletes in 100,000 dies of sudden cardiac death each year. Changes in the heart's electrical signaling often causes sudden cardiac death. A very fast heartbeat causes the lower heart chambers to squeeze fast and in a way that is not coordinated. This life-threatening type of irregular heartbeat is called ventricular fibrillation. Anything that strains the heart or damages heart tissue can increase the risk of sudden cardiac death. Thickened heart muscles, also called as hypertrophic cardiomyopathy. This genetic condition is the most common cause of sudden cardiac death in young people. It causes the heart muscle to grow too thick. The thickening makes it hard for the heart to pump blood. This can cause fast heartbeats. Long QT syndrome. This heart rhythm condition can cause fast, chaotic heartbeats. It's linked to fainting for no reason and sudden death, especially in young people. If you are born with it, it's called congenital long QT syndrome. If it is caused by a medicine or health condition, it is called acquired long QT syndrome. Other irregular heart rhythms can cause sudden cardiac death. This includes Brugada syndrome and Wolff-Parkinson-White syndrome. Forceful hit to the chest. A blunt chest injury that causes sudden cardiac death is called commotio cordis. Commotio cordis may occur in athletes who are hit hard in the chest by sports equipment or by another player. This condition does not damage the heart muscle, instead, it changes the heart's electrical signaling. The hit must occur at specific time in a heart signaling cycle. Heart condition present at birth, also called as congenital heart defect. Some people are born with changes in the heart and blood vessels. These changes can reduce blood flow and lead to sudden cardiac death. How do we know if a young person is at risk of sudden cardiac death? Many times, sudden cardiac death occurs without warning, or warning signs may not be noticed. Fainting, also called syncope, shortness of breath or chest pain. These symptoms could be a sign of heart problem, but conditions such as asthma also can be the cause. That is why it is important to get a complete health checkup. Family history of sudden cardiac death. This family history makes a person more likely to have the same type of heart event. Depending on the underlying condition, the medicine or surgery may be recommended to lower the risk of sudden death. For example, a device called implantable cardioverter defibrillator (ICD) may be placed in the chest. This device continuously checks the heart rhythm. If a life-threatening heart rhythm change occurs, the ICD delivers electrical shock to reset the heart. Many athletic training centers have a portable device called Automated External Defibrillator (AED). An AED is used to treat someone during cardiac arrest. It delivers shocks to reset the heart rhythm. Each individual should know how healthy their heart is. One has to undergo few tests rather than depending on one test. Regular checkup at least once a year is recommended.
Presented to you by Health Today. Like, share and subscribe.